Good morning, everyone. My name is Janet Robinson. On behalf of the New England QIN-QIO, thank you for your participation in the Nursing Home Quality Care Collaborative, and welcome to our webinar. The topic today is difficile event reporting for NHSN. Before we get started, I'm going to quickly review a few housekeeping items. This call will be recorded for training purposes. I will provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation. We will take questions at the end, and I will provide you instructions on how to unmute your line. If you would like to pose a question during the presentation, you can do so in the chat box at the bottom right of your screen. Please make sure to send the questions to all participants so that we can keep up with the incoming questions. Next slide, please. Before I begin the presentation, I just want to share that I have had a cold for a week, which has affected my voice and left me with an annoying cough. I actually feel quite well, but I do ask for your patience if I pause for a moment to sip my warm tea. Our previous two webinars detailed... I'm on the wrong screen. Can I have the next slide, please? Thank you. Our previous two webinars detailed the enrollment process for joining the National Healthcare Safety Network. Today, I will explain how to record the data you have begun to collect. Please have your copies of the event form and the denominator form handy for when we get to those slides. The objectives are: define laboratory identified event surveillance and reporting terms for Clostridium difficile. Describe how to complete the event form and enter CDI LabID Events into the National Healthcare Safety Network. Describe how to complete the denominator form and enter the numbers into NHSN. And describe how the facility and the CDC will use the data. I think we would all benefit from a quick review of the Clostridium difficile initiative. Nursing homes all around the United States, including yours, have agreed to provide 10 consecutive months of Clostridium difficile infection data into the National Healthcare Safety Network, or NHSN. We, along with CMS, the Centers for Medicare and Medicaid, want to thank you for that. These numbers will establish a national database for the rates of Clostridium difficile in long-term care. A strong commitment to accurate entry each and every month, even those without a positive CDIP test, is very important. So many nursing homes are signing up with NHSN that the approval process has slowed down. The October 31st enrollment deadline has been extended, so there is still time for those of you who got a later start. October data will be entered as planned, even if NHSN later decides that they're going to use November or December as the beginning month for the 10 consecutive months of data. Remember that NHSN participation is likely to be mandatory for long-term care within a few years, just as it is in hospitals. We are happy to be able to help you get ahead of this requirement. Next slide, please. To simplify the presentation and make the most of our time slot, I have combined slides from the CDC training with some of my own. The full CDC training session is available for anyone who would like to view it, and this slide contains the link to that full CDC training program. Next slide, please. There are many reporting options in NHSN. For this project, it is only Clostridium difficile we are interested in. So at any time when you're in the NHSN program, if they ask you to select a component, it's always the long-term care facility component. The module that we are using is Laboratory Identified or LabID Event, And the organism type is C. difficile or Clostridium difficile. And if you look on this slide, you'll see the areas of interest are right in that nice rectangle in the middle of the slide. Next slide, please. So let's look at the precise definition that's going to be used by NHSN to determine what you will actually report each month. A CDI LabID event is a positive laboratory assay obtained while a resident is receiving care in the long-term care facility and the resident has no prior C. difficile positive laboratory assay collected in the previous 14 days while receiving care in the long-term care facility. A simpler way to say that is that it's going to be the first ever positive test for that resident or their first positive in 14 days. This is also called a non-duplicate LabID event, and this is what will be reported. You will not report a duplicate CDI LabID event, and that will be a C. difficile positive laboratory test from the same resident following a previous positive test within the past 2 weeks or 14 days while in the facility. And let me do a little example so you all understand this better. On October 1st, a resident in your facility has their first ever positive C. difficile test. That will be a CDI LabID event on October 1st, and that would be reported. On October 6th, another test is done for some reason. That test is also positive. That would not be reported because that would be considered a duplicate event. Basically, it's still the same infection. So, October 1st is reported, October 6th is not. On October 17th, there is another positive test for that same resident. While it has been 14 days since October 1st, it has not been 14 days, or 14 days or more since October 1st. It has not been 14 days since October 6th, and you only have to measure from the last positive test. So the positive test on October 17th is also a duplicate, and this would not be recorded because it is less than 14 days from October 6th. However, a positive test that is done on November 6th, now it's been 14 days since all of those previous tests, and that one would be reported. And the takeaway from that is that to determine if it's a duplicate, you only have to measure from the most recent positive test, even if it was itself a duplicate and not reported. Next slide, please. Some other testing information. When you are doing reporting into the NHSN or CDI, you're going to be reporting to your entire facility, not just certain units. Although you will indicate what unit the resident was on when the specimen was collected, you do have to include all units when you are testing so that you're reporting facility-wide. And you will only be reporting lab results from within your facility, nothing from an outside facility, and nothing that happened before the resident was admitted. I think it would be very helpful to keep a log of your positive C. difficile test results with dates, and that's going to help you keep track of that duplicate test situation. C. difficile testing is done only on liquid stool samples. Most laboratories will not even accept anything but a liquid stool sample for C. diff testing. Keep in mind that that toxin is often present in warm stool even after successful treatment. But if there is no diarrhea, it is not going to be considered an infection. So we only would be sending in liquid stool samples. Next slide, please.
Before we go on to the next slide, I'm going to mute everyone again. We have some participants that are unmuted at the moment, so you'll have to unmute yourself again, so bear with me.
Okay.
And we have a few participants that are unmuted. If you could manually mute your own line, we would greatly appreciate it. Thank you.
How do we do that again? We should be, they're hearing us, I think.
Yes. Yeah. Is it star 6? No, if you could press star 6, it should mute your own line.
Okay.
Thank you, good, Jenna, if you want to continue.
All right, thank you. Sorry for that little delay. Please refer to the event form, your paper copy that we suggested you have handy during this presentation. You can refer to that for the next 5 slides. A CDI event form, you're going to fill out one form for each positive, non-duplicate test or event. The information on that paper form is going to be entered into the NHSN database by an approved user. An approved user is someone who has a SAMS card. Now, I want to put a plug in here. If there's anyone attending today's webinar, if you are the only person in your facility with a SAMS card, you really want to add other users. Whoever registers the facility with NHSN, with designated NHSN facility administrator, can add other users. This is going to be essential if someone is on vacation, if someone is on a medical leave, if someone gets a job somewhere else. You want to have at least 2 people, you would be even better, who have access to NHSN. So again, if there are any users online and you're the only user for your facility, I strongly encourage you to add additional users so that you can have more than one person with access. Then you have to fill these forms out for a month. The total number of events, the total number of forms that you have, which will enter into NHSN, that's going to become the numerator for the month for NHSN to do their calculation. The event and denominator information must be entered by the 25th of the month for the previous month. So October data must be entered by November 25th. November data would have to be entered by December 25th. And may I have the next slide? And I just lost my picture. You just put that. Oh, okay, yeah, you do. Got that. So any of you on the line who feel that you're not very computer proficient, believe me, I'm with you. I have help here today, and I'm very grateful. Here is a picture of the form if you don't have one with you. The form starts off with patient demographics. Please look at the section just below that, which asks for the resident type and the date of first admission. I'm going to go over those definitions for you. Next slide, please. The date of first admission to the facility. This is the date the resident first entered your facility. If the resident leaves the facility for more than 30 days and returns, now there's going to be a new date of first admission. So again, it's the definition of the resident as the date the resident first enters the facility. If they leave for more than 30 days and come back, then there would be a new date of first admission. The definition for short stay and long stay is based on the date of first admission. Short stay is less than or equal to 100 days from the date of first admission. And long stay is greater than 100 days from the date of first admission. The other information that they want is the date of current admission. This is the most recent date the resident entered the facility. If you have a resident who has not left your facility for more than 2 calendar days, then the date of current admission is going to be the same as the date of first admission. And to make this more clear, we're going to look at an example to better understand. Next slide, please. So here's our examples for admission dates. A resident in your facility since February 1st, 2015 is transferred from your facility to an acute care facility on June 2nd, 2015 and comes back to you on June 10th. They're gone from June 2nd to June 10th. So the current admission date would be June 10th because the resident was away from the facility for greater than 2 calendar days. The date of first admission remains as February 1st, 2015, since the resident did not leave the facility for greater than 30 days. 1 week later, the same resident goes to the emergency department for evaluation on June 15th, returns on June 16th. The date of current admission stays as June 10th because he was not away from the facility for greater than 2 calendar days. Next slide, please. Looking back at your event form, please look at the section titled Event Details. It's going to ask you for the date the specimen was collected. Remember, you're only going to be recording specimens collected in your facility, nothing that happened before the resident got there. Under specific organism type, the answer is going to be C. difficile, and that's just a check-off. The specimen body type or system, it's the digestive system, which NHSN shortens to DIGEST. And the specimen source is always going to be stool. You also need to enter the resident care location. This is the unit or the floor that the resident was on the date the specimen was collected. These are location designations that whoever enrolled your facility entered into NHSN. So it might be second floor, third floor, Bristol unit, Narragansett unit, whatever it is. You want to make sure that you put that location in for where the resident was at the time that the specimen was collected. Primary resident service type, you check which one is appropriate for that resident. A few questions then: has the resident been transferred from an acute care facility in the past 4 weeks? That's a yes or a no. If you do answer yes, you need to put in the date of last transfer. And if you answered yes, please indicate if the resident was on antibiotic therapy for C. diff at the time of transfer. Again, if the resident came into your facility already on treatment for C. diff, you would circle that yes answer. Those other fields, the custom fields and the comments, those are not required, so you really don't have to worry about those at all. And basically, you have now completed filling out the event form. Again, 1 for each positive C. diff test. That meets the definition for an event, not the duplicate test. Next slide, please. Please reference the other paper form that you have, the denominator form, for the next 2 slides. This is the information I'm going to talk about. I'm going to move to the next slide just so people who may not have their form can be looking at what the form looks like as I go over the information. Next slide, please. So what is needed for data entry is going to be the monthly totals for the columns that are indicated with the arrows. You don't have to worry about the columns that say urinary catheter or the one that says antibiotic shots for use of indication. Those don't have anything to do with Clostridium difficile, so you're just interested in the columns with the arrows. You're going to be wanting to enter the total for the month, which is the bottom of, you're going to have to add them up at the bottom of each column. Resident days refers to the number of residents in bed on that day, not your bed holds. Just the number of residents who were in bed on the 2nd day of the month, the 3rd day of the month, etc. Number of admissions refers to admissions and readmissions, and again, you would have that information entered for each day. And the number of admissions on C. diff treatment also refers to admissions and readmissions. Now, you may not have to record this every day. In some facilities, you may be able to access these totals once a month from your business office or from someone else in the facility. But some of you will have to do this part yourself, where you put in this information for each day and then total it up before you go in to put this information into NHSN. Next slide, please. With your 2 forms handy, you are now ready to enter this information into NHSN. So you would log on to sams.cdc.gov. You're going to need your username, your password, and you're going to need your grid card. Please notice the red rectangle here. You want to make sure this is where you click to log in with your grid card. Once you have logged in, next screen please, you are going to select NHSN reporting, and you can see the red arrow is pointing there. NHSN reporting. Next slide, please. Now, this slide is where you're going to select the name of your facility. Because you haven't had anyone entering data yet, I am not positive about that first group there. It says select facility or group from the drop-down list. I think that for right now what you're going to see is your facility name in that box and also in the next box. I believe what this is referring to is for some of you who are part of corporations, when your corporation forms their group within NHSN, you may see your corporation name in where it says select facility group in the top bar there. And just being honest with you, I don't actually know exactly how that's going to work yet. So you want to make sure that you select your facility name. Remember, the component is always going to be long-term care facility, and then you're going to hit the submit button. Next slide, please. Even though you are reporting for the entire facility, you will be recording the location of the resident at the time the specimen was collected. So you need to make sure that the locations have been added. Those of you who are also the facility administrator, you have probably already done this. I hope that you've already done this. But NHSN does like you to check before you put your data in. So, using the navigation bar on the left side of the screen when you are in NHSN, you would select facility where the red arrow is pointing. You would then select locations where the red arrow is pointing. And then you would click on the Find button, which is in the middle of the screen. That will bring up your location table so that you can make sure all of the locations, the units of the floors of your facility have been added. Next slide, please. The monthly reporting plan for your facility must be in place before you can report data. You can set this up for 1 month, or you can set it up for 12 months in advance. If for some reason you have not already done this, you could do it now, and you really do need to do it before you can enter data. So using the navigation bar, you would select Reporting Plan, and then you would select Add. The name of your facility will automatically fill in, and then you would select the month and the year. For this initiative, we're looking at October 2016 being the first reporting month. And then you would select, right, see in the middle of the screen there, that nice blue rectangle. The module that we are using is the LabID Events module. The first item there under location, here they're not looking for the individual locations, they're looking for facility-wide inpatient, so that would be what we would select. Again, the organism type is C. difficile, and that last box here will check automatically once you put in C. difficile. Remember, again, reporting is going to involve all of the units. And again, you're not worried about HAI module, you're not worried about prevention process measures module, it is just LabID Events module. Next slide, please. Once the monthly reporting plan is complete, you're going to be able to put your events in, and this is just another little review or reminder about what information gets put in. So I read this first bullet over 3 times, and I thought, what are they trying to say? The LabID Event module protocol must be used to identify C. difficile LabID events. What that means is you have to use their definition, which is the one I reviewed earlier, the positive lab test. You're not going to be putting in the patient who's had diarrhea for 2 days and you think they have C. diff, but the test isn't back yet. You're not going to be putting in the resident who's had C. diff before and you're pretty sure that's what it is, but you haven't done a test. The only unit of measurement used for this project is going to be an actual positive test. The second bullet is the reminder that you're going to put in the location where the resident was at the time of specimen collection. Excuse me. And again, a reminder that we don't do any lab results from outside facilities. Next slide, please. Next slide, please. One more review of which tests we report and which ones we do not. So we have dates on the left, dates of positive CDI lab tests, a column to indicate is this a duplicate or not, and then a column, do we enter it or not. A specimen from January 3rd, first specimen ever, first positive specimen ever on this patient, that is not a duplicate, so it will be entered. Dates of January 9th, January 20th, and January 29th, when more testing was done. These will all be duplicates because they are all within 14 days of the last positive test. However, a specimen on February 23rd would not be a duplicate, and that one would be counted. And here is the reason that I'm going over this again. So you've entered that positive lab test from January 3rd. You try to enter the one from January 9th. The system is not going to let you do that because the NHSN system knows there was already a positive test on January 3rd. So you will not be allowed to enter that as a LabID event. But if you try to enter the event from January 20th, the system would let you do it because the system doesn't know that there was another positive test on the 9th. So you have to be smarter than the system and keep that line listing that I mentioned so that you have a record of the positive tests and the duplicate tests. Of course, the best way to handle this is not to be doing more secret testing once you have that positive test result. But if there are other tests that go out, you have to be very careful about the dates and make sure that you are only entering the NHSN-defined laboratory ID event. Next slide, please. Using your paper version of the event form, you're now ready to enter that data into NHSN. From the navigation bar, you're going to select Event, then you will select Add, and then basically you're just going to transfer the information from the paper form to the screen. Any field that contains an asterisk is required information. This is a training slide, so it actually repeats the admission definitions that I went over earlier. I won't repeat them again. I think you're pretty tired of me repeating over and over what you report and what you do not report. The name of your facility is going to be automatically entered on the screen, and you will fill in the rest of the information from that paper form. For those of you who may not be experienced in filling out forms online, clicking on the little down arrows in the boxes brings up your choices for that box, and then you can just highlight and click on your selection. So again, you see all the same information that is on the paper form. You will just now enter it here. Next slide, please. I think you can see that having the paper form completed makes this data entry go very quickly. And one more reminder, right here on the screen in red, making sure you enter the location of the resident at the time of specimen collection. And I think I keep repeating this because you may have a resident who you collect a specimen on Monday, and for some reason on Wednesday they get moved to another unit in your facility. But it's where they are at the time the specimen was collected that is important to NHSN. Please note the box that is for NHSN internal use only, and again the two optional rows at the bottom that you don't really need to worry about. Next slide, please. Do not forget to save the event after you have put in all of the information. You will then get an event number to let you know that you have successfully saved the event. I'm going to suggest you jot down that event number. Perhaps you can put it on the line listing next to the specimen that was submitted. That will help you if you want to retrieve this information later from the system. Next slide, please. Now you'll use that paper denominator form to enter the numbers for denominators into NHSN. Remember that you will be entering only the monthly totals from the columns I discussed earlier. So at the end of the month, you're going to enter each monthly total denominator for the month into the NHSN application. Using the navigation bar on the left, you would select Summary Data, and then you would select Add. Again, the name of your facility is going to be automatically entered, and then you're going to select the month and the year that you're going to want to report on. And again, for our project, the first month is going to be October 2016. Next slide, please. This is just to let you know what the blank page is going to look like. And again, you'll see right in the middle there the information. It says MDRO and CDI LabID Event Reporting. Remember, we're just looking at CDI events. Next slide, please. Now, here's a close-up view of that information that you're going to put in. And you'll see that there's a box for resident admissions, for the resident days, and also for the number of admissions on CDIS treatment. You enter this denominator data, even if you have a month where you did not have any positive tests. For the calculations to be accurate, there must be denominator data for every month, even a month where you did not have any positive CDIS tests. And you can see there's a checkbox that's going to appear, and under CDIS there is a check mark that's automatically going to be there based on the information that you did for your monthly reporting plan. Next slide, please. If you did not have any positive tests, there is a box, you see red asterisk next to it. That is the box that you would check that says Report No Event. And I'm really stressing this. You cannot just skip the data entry for the month. You must put in the denominator information, and you need to check off that box. Next slide, please. The NHSN system has a way to let you know if you did not enter especially your denominator data correctly. They call it the Resolve Alert page. I think of it as the Oops, You Forgot Something page. Most of the time, what has been forgotten is the summary or the denominator data for the month, or it has been entered but it has not been entered completely. So you will get a screen that looks like this, and it will tell you exactly what is missing. Next slide, please. Most of the time, what's missing is that the check boxes for Report No Events has not been done properly. And a couple of more pieces of information about that. If your LabID events have already been reported, let's say you had 2 positive tests and you entered them in for the month, the Report No Events box is actually going to be disabled, so you won't be able to check it. Supposing you do check it, and then you find out, oh, I forgot, so-and-so did have a positive test, I need to enter that. What am I going to do? You go in, you enter the event, and the Report No Events box will automatically uncheck. So there's a number of systems in place here to help make sure that the information gets put in accurately. Next slide, please. Here's another picture of what the homepage is going to look like if you have to resolve alerts or fix something that isn't correct. Now, this is a training slide, so this facility looks like they haven't done anything correctly. When you get this page, and you are not likely to have this many bullets on your page, what you do is you click on the blue or the underlined hyperlink so that you can see what is wrong. So for this example training page, we've clicked on, you have 2 incomplete summaries. Next page, please. Next slide, please. After clicking on that, you'll get this page that says incomplete summary data. It shows you what is missing. You can now click on, in this example, let's click on the first one, 3856, so that you can access the page that you need to fix. So you click on that hyperlink. Next slide, please. And here it is, a very common mistake, that somebody did not put a check mark in the box to indicate there were no CDI events. Please read carefully or read along with me the information under the thumbtack. If no CDI LabID events were identified for the month, and this box is not checked, the facility data will be considered as incomplete and may be excluded from analysis. please remember that we're trying to help form a national database, as well as you're trying to form a database for your facility, so we need to make sure that we do the data entry correctly. Next slide, please. So a review. When you go into NHSN to enter this data, you're going to be asked to verify that your locations are mapped. You're going to be asked to review the monthly reporting plan. You would then enter all of your difficile LabID events one by one, saving each event. Then you would put in your denominator data for the month. If something has not been done correctly, you're going to get that alert page so that you can go in and change or you can fix the problem, which is usually related to denominator information. Next slide, please. So what is the National Healthcare Safety Network going to do with this data? They are going to do calculations so that they can categorize CDIP into the four categories that you see listed here. And now I'm going to explain to you what each of those categories means. Next slide, please. Using the specimen collection date, NHSN is going to categorize these LabID events as either incident events or recurrent events. An incident event is any LabID event from a specimen collected greater than 8 weeks after the most recent CDI LabID event entered into the NHSN application, or the first LabID event ever entered for the resident while in the facility. So the first LabID event ever for that resident, or the first event in 8 weeks. A recurrent event is any event entered greater than 2 weeks and less than 8 weeks after the most recent positive lab test. And a recurrent event would basically be an infection that has not fully dissolved. So they're trying to separate new events from just a recurrent infection. Next slide, please. Now they're going to further be able to categorize these events using the date of current admission and the date of specimen collection. So they will be able to decide or put into categories the events that are considered community onset, related to positive tests from day 1, 2, or 3 of admission. These are basically the residents who came into your facility already with the infection, community onset, not in your facility. The second category here would be long-term care facility onset. And these are the residents who have a positive laboratory test on or after day 4. One of the things that I really like about what NHSN is going to do, and I want to mention here, I've been a consultant in long-term care facilities for 25 years. They are going to be able to subclassify the CDI events into acute care transfer, long-term care facility onset. This is basically residents who have had a specimen collection date less than or equal to 4 weeks following their date of last transfer from an acute care facility like the hospital before they came to you. So although the infection is first manifesting in your facility, in your long-term care facility, the seeds of it likely began wherever they were before they came to you. And I know from working with many facilities over the years, this can be an important distinction. So this is what NHSN is going to do with all of that information. I'm going to pause for a moment because I understand that we have a question.
We do have one question. A brand new resident is admitted from the hospital, CDIP positive, and being treated. Do they fill out an event form and record it?
No. You only fill out an event form for positive tests that are conducted in your facility. So the resident who had a test done in the hospital and arrived to you already on treatment would not be counted as a LabID event. You would, however, be recording that when you're doing your denominator information when they want to know how many people arrived on treatment. May I have the next slide, please? So the Centers for Disease Control is going to be establishing national benchmarks for Clostridium difficile facility onset in long-term care, and also benchmarks for how many residents are admitted with C. difficile to long-term care facilities. Obviously, especially in this initiative that we're doing through your QIN-QIO, we are going to be working with you with some prevention strategies. So when data is looked at later, the CDC will also be able to monitor the success of prevention efforts. Next slide, please. Within your facility, you're going to be able to use this data for surveillance of what's going on in your facility related to Clostridium difficile. You'll be able to do benchmarking for your facility. You'll also be able to do internal quality improvement if you want to be looking, well, second floor never has any Clostridium difficile, but third floor does. They'll see if there's something different that's happening on one unit as compared to the other. For those of you who are part of a corporate chain, your corporate chain may want to be looking at some facilities who appear to have very good prevention strategies in place that they can share with another facility. Not on this slide, but something that I actually think is a very important way you're going to be able to use this information is going to be as a way to inform your conversations with your sending hospitals. And let me give you an example. Hospital A and Hospital B each provide 10 admissions a month to your facility. Later on, you look at 12 months of NHSN data that you combine with your own facility data, like where the patients come from. And when you look at that data, you find out that from Hospital A, 60% of the admissions you take from them arrive with Clostridium difficile or develop it within 4 weeks. Hospital B, only 20% of their admissions arrive with C. diff or develop it within 4 weeks. Isn't that a piece of information that you would like to have when you're working with those hospitals and you're deciding what patients you're going to take into your facility? Next slide, please. That is pretty much the end of my presentation. I want to remind you that there is a full presentation from the CDC available with the link that's on this slide. This presentation from the CDC does have 23 slides that have 6 different case studies. And I know that some people enjoy case studies as a way to learn. We really did not have time for that today, but I do want to mention if you did go to this training site from the training program from the CDC, there would be case studies for you. Next slide, please. So now it's time for questions. If you'd like to ask a question, please unmute your line by pressing #6, or you may pose a question in the chat box. Do we have any more questions in the chat box? None so far. Actually, one came in straight to the presenter, so if anybody posed a question, they might want to post it to all. Sandra, I can go ahead and read that question. Rosemary had a question on slide 28, which I can go back to. Please go over how to record no events again. There are many boxes with asterisks. So do you want me to go back to slide 28? Yes, you can put slide 28 up again. I can easily answer that question. When you're going to enter no events, you're going to be putting it in the box underneath Clostridium difficile. Across the top there, we see MRSA VRE, we see CRE enterobacteriaceae, we see a lot of organisms. The only organism we are interested in is Clostridium difficile. There will also already be a checkbox where it says LabID Events or specimens. There will be a checkbox under C. difficile because that's the target organism that we're looking for. So you will be checking the no events box just below the LabID event box for Clostridium difficile. And I hope that answers your question.
Hello, my name is Bruce. Hello, my name is Bruce.
Hello.
I have a question. Hi, I have 2 questions. If a test is ordered on 2/28, the school is obtained on 2/28, but the results come back positive on 3/2, which month is the C. diff recorded in?
The date of specimen collection.
Thank you. And the second question is in regards to the test that will determine whether or not the C. diff was contracted 4 weeks prior to admission here. do we need to order a special C-diff test in order to gain those results regarding the 4-week lag?
No. The only test results that are going to be entered into the system are tests that are done in your facility. If a resident arrives at your facility already having C. diff, that information is going to be just included in the totals on the denominator form. So if they have come in on C. diff, that is where you're going to report that. And if I'm not understanding or answering your question completely, ask it to me again.
Okay, somebody comes in here and within 4 weeks they are presenting with symptoms, and we have that special test that shows that they contracted it sometime within 4 weeks prior. Is that a special C-diff test that we need to order, or do all C-diff tests give that information?
There is no special Clostridium difficile test to determine that. But the question you're asking is interesting because, no, they're going to use the date of admission for determining if there was C. diff before the person came in. There isn't any special test that you need to order. If the resident, they're going to look at the date of admission, and if the date of admission is within that 4 weeks, and the positive test happens in your facility 3 weeks after the person is admitted, but the date of admission shows that they have been in the hospital, 3 weeks before that. I'm not answering, I'm not saying it very clearly. But you don't need to do a special test. It's the date of admission and the date of specimen collection in your facility that will let them know if they were recently in the hospital. It's not the positive test from the hospital, it's just the fact that they were recently in the hospital. Does that clarify it?
Yes, it does. Thank you very much.
You're welcome. And I'm sorry I had a little trouble understanding that question.
I had a hard time asking that.
We have one additional question. It is related to the question prior, where the brand new resident that was admitted from the hospital was C. diff positive and being treated, and whether or not they would fill out the event form and record it. There's another question saying that if they have a patient with C. diff in the facility for 12 months, and then have a new patient admitted with C. diff in the hospital, are they counting both cases in the number of admissions on C. diff treatment?
Can you repeat that in part for me again?
They have a patient with C. diff in the facility for 12 months, while they have a new patient admitted with C. diff in the hospital. Are they counting both cases in the number of admissions on C. diff treatment?
Well, they look at monthly numbers. So if the patient who has been on C. diff treatment for 12 months, in the facility for 12 months, if that patient has been there for 12 months, they would only be counted as being on C. diff treatment if when they first arrived 12 months ago at your facility, they arrived on C. diff treatment. And that would be counted only in the months that they were admitted. Again, I'm not sure if I'm totally understanding that question. The people who come in already on C. diff treatment are counted in the month that they were admitted to your facility. They wouldn't be recounted every month. Is that answering the question? Am I reading this and I'm not?
No, if not, if there's still confusing, we can reach out to her directly.
Let me repeat again. The only events that are going to be entered into the system are positive tests that occur in your nursing facility. You will not be recording any positive tests from the hospital. So the event form is only for positive tests in your facility. The denominator form is going to contain monthly information concerning the number of total residents in the facility on each day, and the monthly total is what you would report. You would also be reporting on that denominator form the number of admissions each day to the facility, and then the total for the month is entered, and the number of admissions each day who arrive on Clostridium difficile treatment. I expect that for the first couple of months that we're all doing this, I hope that you will, both of you in Rhode Island will call me, whatever state you're in, you'll call your contact person, so we'll be able to help you. This is a lot of new information, we know that, so don't hesitate to call us about that. We did just put up on the screen for you the contact information for each state. Are there other questions?
I have a few in the phone.
Okay. Let's take the question online. Go ahead.
It was actually more than I was going to say. There are a few questions that have come in privately to the presenter as well, so I can move those once my hair is done.
Okay. So go ahead, Morgan.
Okay, some people have been asking about the slides for today's presentation, as well as the denominator form and worksheet that we've been talking about. I just posted in chat the location on our website where you can find all the information. I will add the denominator form and worksheet after this webinar, and I think that's it for now privately, but I will double check.
All right, so Morgan's going to put all that information on the website. I would also mention that the event forms and the denominator forms, you can also obtain those from your state contact people. They are also available at NHSN, but if you're not familiar with that yet, please contact from the slide here, your contact person in your state. These have all been sent out, so they should be readily available to be provided for you. And then you said you have some questions in there.
The denominator for LTCF resident days is the total number of residents or just the CDIF residents?
It's the total number of residents in your facility, not just CDIF. The total number of residents in your facility, people in bed on that day.
Please moving this answer this question. Is there a place where I can get a copy of the denominator worksheet? The ones I have are by month.
That's good. There are the daily worksheets, again, we can make sure that you get them. I know that at least for Massachusetts, there is also another summary form that Massachusetts made that is just for the month, and I'm going to guess that is the form that you have.
If a resident was treated or CDIF in October, it continues into November. Do you count that resident both months on the denominator worksheet under number of positions of CDIF?
You only put on the denominator worksheet the residents arrive at your facility already on CDIF treatment. And it's the number of admissions, so it would only be counted for the month that they arrived on CDIF treatment. And I wanted just to make sure there's no confusion. You're not going to put in that column the people who go on for difficile treatment in your long-term care facility. It's the number of admissions on CDIF treatment. They arrive on antibiotics, either from the hospital, even if they come from another nursing home, people who arrive on treatment, and you just count them for that. Anything else in the chat box?
No, I know.
Any other live questions?
I have a question. It's for Leanne.
Hi, Leanne.
Hi. Okay, so say I have a resident develop CDIF here, and then I have to go into an event, and I write that one out. But is there any box to check on to get into an event that says it's within 4 weeks?
You don't have to worry about that because you're going to be putting the date. That's why it's so important to put the date information that they request. You put the date of specimen collection, you're going to have the date of first admission, the date of current admission. You don't have to worry about that. You're putting in any dates that they request. So you don't have to figure that out, NHSN will do it.
Okay, thank you so much.
You're welcome. I have a question. Okay. When we're talking about our we're talking about long-term care residents and rehab residents, correct? So all of the residents in your facility, yes, you do all units. Okay, thank you. That's why there's that place for long-term stay and short-term. Okay. Other question?
I have a question.
Okay.
I have a question.
Go ahead.
Patient comes in on October 21st, this is Barbara, by the way, October 21st from the hospital, being treated for C. diff.
Okay.
In the column where it says number of admissions on C. diff treatment, I put a 1 next to October 21st.
Yes.
Do I carry that 1 all the way to the end of the month, or just that one day?
No, it's just that one day, Barbara.
So, for the whole month, I'm just going to have 1 in that, the number 1 in that column. My total is going to be 1.
Unless somebody else arrives on another day who is on C. diff treatment. So I'm glad you asked the question. If all of that information on that denominator worksheet, day 1 is filled out just for the first day of the month. You don't carry anything over to day 2. So it says what's going on that day. And notice it says number of admissions on C. diff treatment.
So my total, so my total for the month of October in that column is going to be 1, because I had 1 resident admitted with C. diff.
Your total will be 1.
Okay. The person who, and I do not do an event form on him.
You do not do an event form on him because you did not have a positive test in your facility. He arrived on C. diff treatment. And you only do an event form for a positive test done in your facility.
Right, and they are not counted in the denominator form anywhere.
Well, they're going to be counted when you have the number of residents for each day.
Right, but they're not going to be counted into that last column for C. diff.
No, they're not.
Okay, I got it, thank you.
Okay. We have 3 minutes left, so if there's one more quick question, we can take it. If not, we're going to need to sign off.
We have one other question.
Okay, one other question.
So if I had no admissions in October with C. diff and no one in the facility on C. diff, I will still need to report by November 25th.
Yes, you would be reporting your denominator information. You wouldn't have any events, and you'd be checking off the no event box, but you would still need to report your denominator information, even though you did not have any positive LabID events.
Okay, one more. On the denominator form, what is the total number of residents on the bottom of the form?
That's added up all of the number of residents from each day. It's just totaling the column. All right, folks, I need to do the closing comments now. When you close out of this webinar, the evaluation will automatically pop up on your computer. If you could please fill that out, we would appreciate it. If you don't have time to fill it out right now, or if you are sharing a computer with someone else, you will receive an email tomorrow morning with the link to the evaluation, as well as the link to the event page on our website. Today's presentation is posted on our website, and within the next week, a recording and transcript will also be added. And in closing, just one last reminder, your state contact information is available on this last slide, and please call us with any questions. We are happy to assist you. Thank you so much for your participation today.
Thank you. Bye, thank you.
Thank you.
Disconnected. The conference will be terminated in 5 minutes.